All right, welcome. This is Abby from Burd Psychotherapy, and I have the pleasure of talking today with a new friend, acquaintance, and colleague named Helen. Helen, could you introduce yourself?
Yeah, Abby, thank you for having me here. I'm super excited about talking to you, and I just love what we're about to talk about. I am a doctor of nursing practice, so a nurse practitioner, and double board certified in adult geriatric and family care, and menopause certified by the Menopause Society. So my practice is primarily perimenopausal women, but of course later than that and earlier than that with like hormone difficulties. So super happy to be here.
Awesome. So we recently connected through the local Postpartum Health Alliance. And
Mhm. Yeah.
so, have you always been interested in perinatal mental health or perinatal health?
No, I would say actually that's not been like my focus, but it has come into focus both through my own experience of having a child late in life. I had my wonderful daughter at 43 years old, and then just connecting with the community and the mental health specialist, the pelvic floor therapist, all who are in this world. I've started to really put the pieces together of how our worlds and our patient population, women's health population interconnects. That's become very much in my telescopic view lately.
Yeah. And so when we connected, we started talking about the conversation we wanted to have here today with all of you, which is with more women having children later, something I've
Mhm.
noticed in my practice, and you've noticed as well, is that the hormonal changes of postpartum period really just kind of roll into and get confused with the peripartum. I'm sorry, with the perimenopausal stage.
Yep.
And
Yep.
so it's like hard to even know the difference, or like, women are like, well, I thought I was still having postpartum, but I'm the 45. So what does that mean?
Yeah, 100% is happening to more and more women. In fact, I think this might be now the highest demographic we've seen of women having babies now in their 40s or above like late 30s than we've seen at any other time in history. And yeah, it's very interesting rolling into this perimenopause time. And it's a very confusing, often very distressing transition
Yeah.
as a new mom and then going into perimenopause. And we can dive into all of these different things, but the mental, emotional health changes that come with hormone fluctuations, the physical changes, it all leads to this huge just world of confusion and distress. And that's kind of why I've become very, very passionate about educating women. Because it's like you said, it's like, oh, this is just postpartum. And while I might have some difficulties, I'll get through it. And then 2 years later, you're having the same issues and you're like, this isn't postpartum anymore. What's going on with my body, right?
I think it's so true. I think when I kind of got into this niche, I was interested in postpartum depression, and then I realized it was
Mhm.
so much bigger. It was also postpartum anxiety. And then I realized the peripartum stage has so many kind of hormonal moments that impact our
Yes.
health at so many different stages. For example, I've worked with people who were totally fine in the postpartum stage until they stopped breastfeeding. And then that
Hmm.
weaning was this hormonal shift that made them suicidal. Um,
Hmm.
yeah,
Hmm.
so it's interesting. I remember kind of learning, and it's like, oh, of course, like for folks that have had some kind of postpartum mood or anxiety, or folks that are more sensitive to the shifts premenstrual, so kind of that
Hmm.
premenstrual dysphoric disorder. You and I were talking recently about
Yep.
um, more an exasperation. Maybe somebody who already has like a little bit of underlying depression and it gets worse in that premenstrual menstrual week. So for any person who's a little bit more sensitive to those hormones, that perimenopausal stage is really likely to be destabilizing.
Yeah, I like that word. And also, I mean, it's kind of it sounds dramatic, but it can almost be catastrophic for these women because what's worked for them before doesn't work anymore. And I actually just took a really cool, I took part of a really cool webinar on ADHD and perimenopause.
Yes.
And
Yes.
it was just one more of those mental, emotional conditions that we women are actually very good at compensating, right? We're very good multitaskers. We hold jobs and families together and ourselves. And it's one of those things that perimenopause doesn't cause ADHD. And again, perimenopause doesn't cause like this or this or this, but it kind of unmasks some of these instabilities. I think that's a great word. And medications that used to work don't work anymore, or rhythms, and even birth control that maybe you absolutely felt great on. You no longer can even tolerate it. You go crazy on it. And so, yeah, I'm really glad we're talking about this. I'd love to share, like, kind of what I went through,
Yeah.
and then I'd love for us to
Why don't you
talk.
tell us your story?
Yeah, and then I'd love to dive into some of like the physiology of what's happening, like in the peripartum time with hormones, and then what's happening in perimenopause, and why there's actually so many similarities.
So
But
let's do that.
yeah, go
But
ahead.
just so we pin one question, you said something so, so appropriate that the strategies we've discovered as adults that work for us just are no longer fitting. Um,
hmm
and I think we'll definitely have to make sure to circle back and say like what are the new strategies? What's going to work?
Yeah, yeah, I love that. And I would like to learn from you too as a mental health counselor because this can have like really um, it can have really huge consequences in how you feel about yourself. You know, we internalize a lot of this. We feel guilty for the reactions that we're having when a lot of it's just physiological that's happening. But my story, just in brief, is that I got pregnant at 42, intentionally so, and didn't realize like how lucky I was to just have no problems with fertility at that point, and had my baby at 43. And she is the great joy of my life, but it definitely took a toll on my mental health, my body. I gained a lot of weight that I could not budge. I was very stressed. I went back to work maybe 2 months after she was born. I I really don't even think I realized how bad it was until I sort of had this I call it my come to Jesus conversation with my husband, where he's just like, I don't even want to come home these days. Like, you're just like complaining all the time. You're so negative, and you're just like being negative all the time with me and criticizing me. And I'm like, oh my God, like I was like panicking. I thought he was going to leave me, and I like just was scrambling for help. And I, started, went to my therapist. I got a psychiatrist, and here I'm a nurse practitioner. I wasn't embedded in this perimenopausal world at the time, but I really had to get some help for myself. I was desperate. I was like, what's wrong with me? Like, and it's really hard for women out there. And I felt guilty, and I was tired, and putting a lot of guilt and shame on myself. And a lot of women come to me with these stories, and I want to talk to you, Abby, about some of this is perimenopausal rage, right? I've heard it described as rage flashes, much like hot flashes, where it's completely unrelated to the trigger, to the level that you should have. Um,
Proportionate in the reaction, right?
yeah, terrible anxiety and depression. And then you combine it with the classic insomnia that can be a huge component of perimenopause, on top of just your baby waking you up. And then that's another thing is like 2 years later, your baby's sleeping through the night, but you can't anymore. And so you're like, the pieces aren't fitting together, right? Something's happening that's not just postpartum. Um, so. Yeah, it's very profound hormonal shifts that are happening.
Well, wow, Helen, that's so much. So thank you for sharing that with us. That seems like it was a really challenging time. And I'm also hearing you talk about it past tense. And so that gives me hope that you're no longer at such an intense place.
Oh, I'm so much better, so much more stable. I got the help I needed. I was able to level out some of my hormones and, counseling. And I found a women's health psychiatrist to also help me. And yeah, I had the resources and really worked with a coach for stress management. I
Mhm.
learned just small things I want to encourage, like our listeners, can make a big difference. Like, I'm sure you teach this all the time, but like I learned to close my computer during my lunch break. I was a super stressed, busy nurse practitioner, and I had so much charting to do, and the patient load's never ending. I learned to just close my computer, eat my lunch, and go outside. And I took a walk around the block.
Love it.
And little interventions like that made such a big difference. And then, making sure I was moving my body and hydrating and eating well. And yeah, so little things like that really help. Having the resources really helped.
That's so funny that you say that because one of my like goals for myself last year was to go outside and walk during the middle of
Mhm.
the day, and just the dramatic difference that made in how
Yes.
I felt in my mood throughout the day versus the days where it's like, oh, I haven't been outside all day.
Yeah, I love it, right? It really did make a big difference for me getting some sunshine. Sometimes I'd turn my little meditation app on, or I would just listen to some music, or yeah, it was very helpful.
Yeah, so thank you for sharing with us your story personally. And so I want to ask a little bit about your story professionally. So, in addition to your DNP as a nurse practitioner, you have MSCP after your name. Could you tell us a little bit about what that means?
Yeah, so that's a certification by the Menopause Society of the United States. So there's also an International Menopause Society. And it's not exactly a board certification, as in it's not like a covered entity that does the board certifications, but you do have to pass a certifying exam. And I took that last year, but I started my NP career in 2020 at a sexual medicine clinic. And I really think it's actually, I love to share this story because I think it's just actually a story of hope for people that things really do. I don't want to sound cliche, but things really do work out. Like it changed the whole trajectory of my life. I couldn't find a job at all because I graduated with my doctorate during COVID, and
Oh,
everything had been shut down. Right, there was hiring freezes. The clinics were all closed down. They were doing telemedicine, and I was getting super anxious and almost panicky, and months were going by, and I um I found the sexual medicine opening on some random job website. I have no idea to this day what it was. And I applied, they hired me right away, and it really ended up changing the whole course of my life. I started seeing women and men with hormonal and sexual medicine concerns. And many young women, many menopausal women. It was profound and fascinating, and none of which we had learned in school. Not a word of this. I don't even think I had known what a pelvic floor therapist was. This is a whole world of women's health that's just not taught. And it was so fascinating to me. And I ended up leaving the sexual medicine clinic after about a year when things started opening up because I was really anxious about not losing my primary care skills, which was super important to me to make sure like I was really using what I had gone to school for. And I still kept trying to incorporate practices that I'd learned. It never left me from the sexual medicine clinic. And I was treating, women's urinary issues and sexual pain and doing what I could, getting some pushback from like assisted living facilities. And a lot of my clients were already very old, 80, 90s, 100s, and established wonderful relationships with them. But there just started to be this passion in me to treat women in midlife, And I saw a whole generation or two of women who, through no fault of their own, missed out on midlife care because of things like the WHI and hormone fear. And we have now learned so much. And I was like, I have to treat women in midlife. I really want to. I want to protect your bones and your heart and, like keep
Yes.
you from getting neurosepsis and from, it just, and I had so much passion. And as soon as I kind of like stepped out and decided I was going to do this, I had so much joy. I didn't think I could do it. I had never wanted to be a business owner, never wanted to own my own practice, just all these self-limiting beliefs. And just things have like just opened up and made way. And I'm so happy every day. I just feel like I'm doing what I love now. So that's kind of my backstory.
So, we were just kind of thinking about how the messages that, my mom's generation got about how estrogen was so scary, so harmful, you had to avoid it. And now everything I've learned just has made me very much see that it could be preventative for long-term health, not only just like helping right now with symptoms. When I look at the research of how many women in their 40s are given an antidepressant or are treated for depression or anxiety, when really the first line should be hormone replacement therapy, because that could not only help the mood and anxiety disorders, but so much else. And for me, one of the things that I thought about was preventing osteoporosis, which I'm at risk for based on my mom's history, based on my build. And so just knowing, as long, it's just kind of like taking your vitamins, taking your calcium, all the things. All right, welcome back. We're talking with Helen about how hormones can really be first line ways of treating depression and anxiety in women in the perimenopause stage.
Yeah, absolutely. I love that you're bringing this up because this is something that is so underutilized. And this is where a lot of women in the 40-year-old age range are getting gaslit and dismissed by their providers. They are, I'm not bashing antidepressants or anti-anxiety medications at all. They have their place and they're very appropriate. But the data actually shows that hormone therapy during this perimenopausal time can actually be more effective, like you were saying, than antidepressants. Antidepressants, anti-anxiety shouldn't necessarily be the first thing that are offered to women when they come for help, when they're saying, like, I'm having hot flashes, I can't sleep, right? I'm having increased anxiety. Well, it should be one of the first questions we're asking is like, oh, like maybe you're perimenopausal. This sounds very, let's try this. And this is this is one thing that I am absolutely so passionate about, and I see this all the time, is
Yeah.
the mental health issues. And my perimenopausal moms that come to me, they're so distressed by the rage, by the irritability. I'm having to apologize to my kids all the time. I was never an angry person, right? I was never anxious. Now I'm having panic attacks in the grocery store. Where is this coming from, right? And what I like to really leave my events with, my consultations with, is a message of hope. Like, this is not your fault. This is not this is not essentially you, right? What this is, Abby, is these are massive hormone fluctuations that are influencing your dopamine, serotonin, GABA receptors in your brain. And estrogen, part of its job is actually a neurotransmitter. We have so many estrogen and testosterone receptors in our brain. Progesterone itself is a huge mood stabilizer, right? That directly influences like the GABA receptor, which is our stabilizing our mood, and dopamine is our pleasure and our happy, receptors. And so when our bodies are going through these massive, like up and down with no rhyme or reason, just utter chaos, can you imagine like that's what's happening in our brains? And it's very similar to the postpartum time. This is why it can be somewhat indistinguishable and very confusing is you go from levels of thousands on your estrogen when you're pregnant to bottoming out. Like you have almost no estrogen in your body during this lactation, immediate postpartum time. This is why you can have that hair loss, right? Hair hates hormone changes.
Yeah.
And, the mood issues and why we monitor so closely for postpartum anxiety and depression because of these massive hormone shifts. So again, this is not your fault. This is nothing you are doing. This is real chemical imbalances, and fluctuations. So,
And before we get to the solutions, and we are going to get to the solutions,
yeah.
let's just talk a little bit about rage, either
Yeah.
postpartum rage, peripartum rage, or in the perimenopause and menopause stage, because I think that's where we start to feel like, am I going crazy? Is there something wrong with me? Kind of personalizing it is when we see this disconnect between the activating event and our reaction, right?
Yeah.
And so that's what feels kind of like out of control, or I'm not myself. I'm judging myself. I'm being mean to
Mhm.
people I love most, my partner,
Yeah.
children, and that can be so very upsetting.
Yeah. I'm laughing a little bit inside because while it's not a laughing matter, it's kind of funny listening to some of the memes or people talking online because it's like your husband's breathing too loud or chewing too loud, and this is literally what triggers the rage, right? Or sometimes it's not
But
that,
that's
but
the
it's
sensory sensitivity. And I think when you talk about like the like ADHD, like getting like activated in the postpartum stage or in menopause, it's because like our sensitivity to sounds and to touch, like they can be changed. And so things that
yes, and
used to
yep,
phase us now can be like what it is it's a nervous system reaction. And so it's similar to almost like a post-traumatic stress reaction where our nervous system is getting so activated. It's like the fight or flight response. And so no wonder you feel like fighting, like, like some people are Googling, like, is wanting to murder my family a sign of perimenopause? Like, yes, it is. Yes, it
yeah. Yeah, no, that's really interesting, Abby, that you would liken that to like
is.
post-traumatic stress, because that is kind of what it feels like.
Yeah.
And I remember like there were times when, like as a mom, you're just like touched out.
Yeah.
Like you love your kid more than life itself, but you're like, please, like stop touching me. And or like I know for me, even now, I get very auditorily overstimulated. If someone just talks and talks and talks and talks at me, like I want to go out of my mind. Or if the a show is playing in the background and people are talking, I'm like, I can't, right? So yeah, it's very that's interesting, right? We become very sensitive to stimuli.
And I do see a lot of folks who also do have birth trauma, or they've gone through infertility, or had a very sick infant, and so or had previous trauma, or both. And so sometimes there are layers of post-traumatic stress on top of the stage,
Yeah.
which, to jump into solutions, there's a lot we can do to regulate the nervous system and to really develop better control over our reactions.
Mhm.
Does it make sense to kind of hear from your perspective, and your discipline, what you do, and I can talk about ways that I help people?
I would love this because I know you and I, Abby, both want this to be a message of hope and practical takeaways that people can do. Just knowing like you're not going crazy and that there are things that we can do to stabilize those hormones. So, from a strictly like medical standpoint, right, is we can definitely work on stabilizing hormones. But I also like to say, along with that, is I can throw all the hormones in the world at you, but if we're not regulating certain physical aspects of your life, they're not going to be as effective. But sometimes it's a chicken and egg situation as well. That is reality, is like, you're like, well, you're telling me to fix my sleep, but I can't sleep. And I'm like, oh, okay, because this is a hormonal issue. So sometimes a little bit of hormones can go a long way to fixing the stress levels and the sleep issues. So every woman and every situation is very individualized. So there's no blanket, oh, this is what's going to fix you, right? Because I don't want to give you estrogen if you're lactating. I don't want to shut down your lactation, right? But there are things that we can do, and there are stabilizing things. And and then we would definitely work on sleep. And maybe you would benefit from a little bit of progesterone for a mood stabilizer. Or maybe this is the time where you would benefit from like an anti-anxiety medication. And also, like you and I were talking about before, is like carving that time out for yourself. And really that can be very challenging for new moms, is really making that a priority and how practically you're going to do that. And I think that's where people like you come in, Abby, right? Is like, and working with the family dynamics and the lifestyle. Um, but yeah, hormone therapy, if you're not immediately like in this postpartum time, there's a lot that we can do to help stabilize these hormones and these mood and the fatigue. And if you're not lactating, we can work on giving you some estrogen. And sometimes women only need it cyclically, right? Maybe you're very young perimenopause and you might do really well during like the luteal phase, which is the week or two leading up to your period when many women start to experience heightened anxiety, increased symptoms like ADHD or increased depression and fatigue. Something we can always treat you, though, is any kind of sexual pain, vaginal, vulvar dryness. That is something I would want to know about if I were like seeing you and doing an intake with you, because that can also cause its own distress, physically, emotionally, relationally. And so, pelvic floor therapy or a localized cream that's not going to be systemically absorbed. So, I hope that helps a little bit.
You have a lot of tools. You mentioned about being young in the menopausal stage, but also could we just talk about age range? Because I actually, we talk classically about women in their 40s, but I think the age range for perimenopausal symptoms can actually be much bigger. So, from your standpoint, what do you see in terms of age?
Yeah, very normally, it's very normal to see um, 35 and above, so late 30s and above. So you are really not in any abnormal class if you start to see perimenopausal symptoms in your 30s. Many women are shocked by this, and I'm so glad you brought it up, right? I just met with a pelvic floor therapist who had her kids at 36 and 39. And she started noticing symptoms, had no idea what was going on with her. And she basically had to like research herself. But I think that I'm so glad you brought that up because that and that alone can be very reassuring for women. And very, you can just knowledge is power, like tuning into your body and realizing, oh, like maybe this is what's
It's
happening to
different.
me.
Something's different for me. I just hear so many cases of what we now call medical gaslighting. So it could be maybe you're younger. So a woman in her 30s, mid to late 30s, is having a provider tell her like, "Oh no, you're too young. It can't be perimenopause." And so I think so much of it is like trust your gut, like trust you. You are the expert in your life.
Yes, trust your intuition. And I also have some information on helping women advocate for themselves with their doctor. We should, I can send you the links or helpful information.
Yes.
But also another thing I really like to tell my women that I think could be valuable is don't let your provider also dismiss you by saying your labs are fine. Many providers just don't know what else to do besides check labs. And so they see these quote normal hormones. Well, maybe they're normal on Tuesday morning, but by Thursday night, you're completely bottomed out and different. We do not treat perimenopause based on labs. It's not helpful. And this is where a lot of women are getting dismissed over and over and over again.
Or
So
going somewhere who's charging them an arm and a leg for labs that might not even tell them anything.
yes, on the flip side, yes, do not spend hundreds of dollars on labs that are not validated.
So you go by
Um,
symptoms, right? You go by how someone's
yes,
feeling.
Yes, yes. This is not to say carte blanche labs can't be helpful in certain situations. Absolutely, they are. And I draw my own whole panel, but I don't even require that before I see you. If I were to see you as a patient, I would go off symptoms, right? I already know what's happening. If you're telling me you're having night sweats and hot flashes, or you can't sleep, or you're having new or increased anxiety, I already know. I don't need labs to tell me, do I want to see your thyroid? Yes, I'd like to see different things, but I'm going to treat your symptoms. So that's super crucial for people to understand.
So if you'd like to kind of hear from my perspective a little bit, my practice, especially in recent years, has focused so much on the nervous system, and a somatic focus. So that's like looking at the
Mhm.
whole body
Mhm. I
and
love that.
being aware of your whole body, and noticing how you're feeling in the moment and where you're feeling things. And so to kind of go, when I'm working with someone who's feeling like their reactions are too big, it could be from post traumatic stress, it could be from hormonal fluctuations, it could be from life stressors, it could be from a lot of reasons. But if I have someone who's, wanting to work on themselves, the first thing I'm going to do is not discount the fact that they're feeling stressed from the world we're living in, right? So I don't want to be coming from a place of toxic positivity, um,
Right.
because things in life are truly hard. Things in our country are truly hard. Things in their family may be truly hard. So it's really important that we're doing both, and
Mhm.
we're validating what's real, and we're looking at what we can do to make things better.
Yep. I love that.
So part of it is kind of differentiating, right? Like, so a trauma response is okay. So imagine you had a baby in the NICU and there was an alarm bell that would go off because maybe your baby stopped breathing. So then when you go home and your baby is breathing fine, but you hear alarm bells, your nervous system is going to react as though your baby could die. And that's a very human biological response to our nervous system overgeneralizing. And so
Mhm.
our work in therapy is to really tap into your inner wisdom to differentiate, is this specifically a scary time, or is this specifically a time to self-soothe? So imagine your house is on fire. Should you sit down and meditate and take deep breaths? No, you should get up and run away and in action. So that stress response is giving you those stress hormones to get up and
Yep.
run, which you want
Yep.
to do. There's a time for action, a time for change, a time to protest, and a time to accept and self-soothe.
I love that. Yep. Our bodies are very intelligent. We need stress responses
Right.
to survive. Yeah.
Right. And
But
so there's times when you hear historically, this is not recent, this is like ancient history, where women in this life stage are maybe leaving an abusive relationship. It's I no longer care. I no longer care about society or fitting in a box. And I think it's also pretty important to embrace like the freedom and the power that comes with this life shift.
yes, I love that so much. I definitely try to give that message as well. Like this is a time of new power, new vitality, really. And many women become actually very creative during this time. And very yes, come into their own. Like you were saying, we don't care as much about what people think. We realize that we start to realize the life that we want. And it's the time for you to start to embrace that. I love it. I love to teach women, like, really, people do say the 50s are the golden years, and I'm really starting to see why. I'm not quite 50 yet, but I'm looking forward to it.
Yeah. And so, if I were working with someone who's in this life stage, it's also a time to kind of look at like your goals and your values and being intentional in your life, that you are living consistent with your values, but also not not being so intentional and such an adult that you're losing your ability to play and to connect with your sense of wonder and as you said, creativity. Um,
Mhm.
yeah, so some of my favorite tools for helping to regulate that nervous system from a polyvagal perspective are brain spotting, which is a somatic therapy that uses looking in particular directions to tap into places in our brain and to process even without words. And so this could be helpful for even pre-verbal trauma before we have words to um, really being a place of connecting connecting to that healing in the body and that inner wisdom in the body. And so that's been a pretty powerful tool that I've seen help a lot of
Mhm.
people. And it's amazing for rage and hormonal rage of any kind.
Beautiful, beautiful. That's going to be very helpful, right? And I love what you said too about like differentiating between whether you do need to leave a situation that's no longer serving you. And I think that this is so important to talk about because a lot of divorces do happen during this time. But being able to sort it out with someone like you, whether this is just hormones with someone like me, and you want to divorce your husband because your hormones are going crazy, or is it because really this relationship is not healthy? And you don't want to make a decision without that empowerment behind it, right? And I think this is where you and I both come in, where both sides of our women's health practice can be so beneficial. I just on a side note, I did hear a podcast that talked about HRT standing for husband replacement therapy. Sometimes that's what it can mean, right? But a lot of times it's these chemical fluctuations.
Well, would it be all right if I maybe leave us with the Serenity Prayer? Have you heard of
Yeah,
the Serenity Prayer?
yeah,
I think
yeah,
the Serenity Prayer like really encapsulates that differentiation, right? And I often think that it's both and it's yes and we want to do both, right? We want to change and challenge injustice, and we want to take care of ourselves.
yeah, yeah.
The Serenity Prayer goes, grant me the serenity to accept the things I cannot change, the courage to change what I can, and the wisdom to know the difference.
Mm, so beautiful.
You have that wisdom. It's inside of you.
Hmm. Trust it. Yep, you do.
Well, it's been a pleasure chatting with you, Helen. So, yeah, so
Me too.
definitely I'll be adding all your links and places for people to find you and anything else you'd want to share.
Yeah, absolutely happy to meet with any of you if you have questions for me or just concerns or want to talk about your symptoms. Yeah, I absolutely do free calls. Happy to talk you through some of this stuff.
All right, take care.
All right.